Good afternoon all. Today we are going to study about DNA gyrase inhibitors. Before we going to study about DNA gyrase inhibitors, what is DNA gyrase? Enzyme, correct. Then what it will do?
It helps in relaxing DNA point.
Oh,
It helps in relaxing of supercoiling of DNA.
correct. Yes, it is the enzyme. It is an ATP dependent enzyme. It involved in a negative supercoiling of an that DNA. So what will happen in it is a DNA. Okay. When it is going for replication after unwinding and all, so it will form positive supercoiling, like so many coils it will happen. It can't further undergo the replication. So this is positive supercoiling. In case if the DNA wants to replicate or undergo to transcription, the DNA should be negatively coiled. Okay, so what will this DNA gyrase will do? DNA gyrase will allow, it will cut the DNA here, and then form proper negative coiling of the DNA. Okay, so this is why the DNA gyrase should be there in our body. Okay, so you can ask me, DNA gyrase in our human body also, in the bacterial enzyme bacteria also. So if the DNA gyrase inhibitors when we give to a patient, so it can act on DNA gyrase of our human body, right? So why it will not act?
We don't have DNA.
Yeah, the DNA gyrase what is present in the bacteria and human beings are different. So we have this DNA gyrase comes under the topoisomerase enzymes. It has 1 to 4 classes. This DNA gyrase comes under class 2 enzymes, and almost all the DNA gyrase inhibitors will act on class 2, that is gyrase, and class 4 topoisomerase. Okay, first I will tell the mechanism. Now we got to know about DNA gyrase. Now what topoisomerase will do? Okay, so after unwinding all the replication happens, the daughter DNA will be formed. Okay, the daughter DNA are formed and they are fused. Daughter DNAs are fused. We have to cut the daughter DNA, right, to undergo further replication. So what topoisomerase will help here to help the unwinding of this daughter DNAs. So daughter DNAs will further undergo cells and forms other DNAs. So these are the two enzymes mainly the quinolones acts. So DNA gyrase inhibitors are fluoroquinolones. Sorry. Okay. Fluoroquinolones. The drugs which comes under the fluoroquinolones are norfloxacin, ciprofloxacin, and then moxifloxacin. Ofloxacin or levofloxacin. Yeah, the levo form of this ofloxacin is a levofloxacin. Okay. Norfloxacin come into the study of norfloxacin. This norfloxacin half-life is 1 to 5 hours, and these drugs will not undergo to serum levels. Like the concentration of this norfloxacin very less in the serum concentration. Thereby, it is having a less usage. Okay, and then ciprofloxacin. Okay, dose I will tell. Dose is 400 mg per day, and it has a renal excretion also. And then coming to ciprofloxacin, 500 mg. In hospital, ciprofloxacin or norfloxacin will be given with tinidazole. These are moxifloxacin also 500 mg. Sorry, this is 400 mg and this is 500 mg. OD or BD. In case if patient doesn't have any renal impairment, we can give BD. If the patient is having any renal impairment, we should give only OD doses. Okay. And then coming to norfloxacin is having a half-life of 1 to 5 hours. Ciprofloxacin has 11 hours. Levofloxacin has 10 hours and moxifloxacin has having 12 hours. Okay, 12 hours half-life. And most commonly the drug which is used in the hospital are levofloxacin, ciprofloxacin with tinidazole combination. Okay, these are the drugs which comes under fluoroquinolones. Coming to its side effects, if it is a side effects, we have less side effects like GI toxicities, neurocognitive impairment, GI disturbances, and other rashes on the skin or hypersensitivity reactions. These are the only side effects we can see in the quinolones. Okay, that's all about quinolones. Indications, sorry. Indications, UTI. I said UTI, no? Now tell me which drug will be used for UTI. Correct. And? UTI, intra-abdominal infections, respiratory tract infections, skin and soft tissue infections, or sexually transmitted infections. These are the indications of these drugs.
What about in pregnancy?
Pregnancy, it can be given.
Eye infection, moxifloxacin, eye drops.
Yeah, correct. I forgot that. Moxifloxacin, it's not in use, okay. Nowadays, moxifloxacin are not in use. Only for topical purpose, like ointments or the powders, they are using this moxifloxacin. Eye ointment of the eye drops.